The Biomedics non-invasive arterial testing technology is designed to detect peripheral artery disease in a variety of frontline care settings. Keeping educational materials in the waiting room is a great way to encourage patients to start a conversation about any symptoms they may be experiencing. In the waiting room, patients can complete a brief patient questionnaire supplied with the testing system. The physician can review this questionnaire along with the patient's background and risk factors in order to assess if non-invasive testing is necessary. If indicated, only those patients whose history and physical examination results show appropriate symptoms that indicate medical need for the test should be tested. Be sure to ask the patient if they have any condition that would prevent you from taking a blood pressure measurement on their arms or legs. When a PADnet exam is scheduled, it is important to let the patient know that smoking is not permitted 30 minutes prior to the appointment. Because pressure cuffs need to be applied directly to their limbs, the patient should also be informed to bring their own clothing that is suitable for the test, such as a t-shirt and shorts that are not constricting. When the appointment has been confirmed, you may wish to enter any available demographic information ahead of time. Once the patient has changed to appropriate clothing, they are ready for the exam. They should rest for 5 minutes in a comfortable position for the exam. For the complete arterial test, you will need to apply the ankle cuffs, calf cuffs, above knee cuffs, and arm cuffs. And you may optionally apply the digit cuff to the toes. Only the appropriately labeled cuffs should be used on the corresponding extremity location. It is important to maintain consistent cuff placement and tightness. If one or more fingers easily fit between the cuff and the skin, the cuff is too loose. The entire cuff should be touching the skin in most circumstances. Next, place the photoplethysmography, or PPG probe, on a finger on the patient's right hand. You will move the probe down to the toes after arm pressure testing is complete. Remember to enter patient's insurance, name of the referring physician, and the physical signs and symptoms. On the Indications tab, select the relevant indication by checking one of the 6 boxes. To insert the ICD-10 code, follow this by clicking the Select option and then checking the relevant ICD-10 code. Click the Test tab and then the Perform button to begin the test. Follow on-screen instructions for cuff connections and zeroing if necessary. You'll start from the arterial test summary screen. The first location is the right arm. Click inside the right brachial red box on the test screen to begin testing. Connect the hose to the arterial occlusion cuff port on the front of the device, then connect the other end of the hose to the right arm cuff. Click the Start button on the screen or press 1 on the laptop keyboard. For arm pressures, the system will first display a reading from the PPG probe on the right finger and ask you to confirm a pulse. If you do not have a PPG probe, you may skip the affected portions of this test. Upon confirmation, the system will record the air pressure for this location using air cuff technology. During the exam, ask the patient to lie still and keep conversation to a minimum. Test measurements that have been affected by patient movement are usually not acceptable to send for interpretation. After pressure has been released from the arm cuff, select and confirm the return of flow as detected by the PPG probe. This measurement provides additional information to support pressure accuracy. Click Save or press 1 on the keyboard to continue. The software will automatically advance to the next anatomical location as the test progresses. Test alternating sides to allow each limb resting time between cuff inflations. Move on to pulse volume recordings, or PVRs, down the lower limb segments. Connect the hose to the right above knee cuff and click the Start button on the screen, or press 1 on the keyboard. This will generate waveforms that flow across the screen. After you have produced a full screen of quality waveforms, click the Stop button or press 1 on the keyboard. The amplitude will automatically record when the Stop button is selected and will display in the bottom left PVR amplitude box. The software will guide you to complete the PVR process for each required anatomical site. The toe measurements, while clinically valuable, are not necessary to perform the highest level study. Should you skip the toes, arterial testing is complete. If the patient has non-compressible vessels at the ankle level, you may wish to also complete all toe pressures and PVRs, starting at the right toe using all the same pressure taking and PVR procedures you use for the ankles. Repeat the process at the left toe. After the test is complete and you have exited the test summary screen, select a read site and click the Test Signed box on the Test tab. Now you are ready to send the test to your interpreting specialist or reader via the Seamless Biomedics Collaborative Care Network. From the home screen, click Send Receive and then click Send Sign Tests. The test has now been sent and will be returned soon. The reader will look for indications of disease and provide expert interpretation of the test. To retrieve interpreted tests, click Send Receive from the home screen, then click Get Scored Tests. Then click the Interpreted tab to display all interpreted studies. You can print the test by clicking the Report tab. Check the desired items and then click Print to send the document to the printer.